While we are talking about advantages, which are the area of controversy among surgeons, what's your view? Is it more trustworthy method, the hip resurfacing, than the traditional approach, the hip replacement?
It is the best implant when it is used according to the indications. If we use any implant, not according to the indications, but we, make the indications wider, yes, then we meet the problem. If it is used the way it should be used, yes, for the certain patients, like quite young, male, active, with the good muscles, good bone quality, then the implant is perfect, yes. The contraindications are allergy to the metal ions like nickel or chrome and others. So we should ask patients about the allergies. The bone stock is very important. If the bone quality is not good, then the implant will loosen. If the muscle function is not good, then we'll have a problem with the mobility. It is obvious. So when it is used according to the indications, it is perfect. When it is used against, then there's a problem. The other problem for surgeons is that this operation is more difficult than the total hip replacement. And it was the problem in the beginning when surgeons started to do this operation, that they have a learning curve, and the problem that they have a good experience in the total hip, but it is not total hip. It's different. It takes more time. Yes, requires a different approach, wider approach, and if we try to do it as it is a total hip, then it is also a problem. So it's more experience, long-lasting, and more difficult. And the learning curve is a bigger problem than in the total hip. That's why so many orthopedic surgeons who started with this, then they meet the complications, the learning curve, and then they decided that the implant is bad. So, the implant also requires very experienced and skilled surgeon. Yes, so it is more demanding
as
technique. As I am now. Yes, I was not, but I had a good teacher. Yes, and then I learned it, and now I'm skilled to this. So there were two problems: unskilled surgeons, poor quality of implants, and it caused a big problem with the metal debris, metal ions, and all this rumor around the hip resurfacing. That's why many centers had resigned with implanting this. Many surgeons had resigned, and it made good for the method. Yes, because now all the centers, all the surgeons who do it, they are skilled. Yes, experienced. The Birmingham hip resurfacing in the national registers has results more or less the same as the other implants.
And all of these complications are common, or these are just a few examples?
As I have read recently in the Australian registry, the complication rate for BHR is 6% in 10 years. So it is comparative to the other implants. So
okay,
not bad.